Hello, everyone. Can you imagine being 3 weeks old or having a child who's 3 weeks old who has an engorged deer tick followed by an erythema migrans rash, then has to get treated for Lyme disease and within 2 hours develop a Herx reaction? Well, I'm going to discuss this case so we get to understand Lyme disease a little better. This is part of a common sense Lyme disease series based on my practice working with Lyme disease for over 37 years. So let's begin. This study was published in the year 2020. I'm discussing this again as a physician, but also as a clinical epidemiologist and as an evidence-based medicine guideline author. It's not intended to replace a careful evaluation by your doctor. Now, this was a child 3 weeks old who had already had an engorged tick removed. And of course, an engorged tick means there's a greater probability of passing the tick-borne illness. There was also an erythema migrans rash, which helped make the diagnosis, since it's pretty difficult to make a diagnosis of Lyme disease in that young a child. The clinical diagnosis was early disseminated Lyme disease, sometimes called early localized Lyme disease. Intravenous ceftriaxone was prescribed by the authors. Now, intravenous ceftriaxone does not work for Ehrlichia and anaplasmosis or Babesia, which are common tick-borne illnesses. So I typically follow the patient carefully to make sure that they don't need additional treatment. In this case, within 2 hours of IV ceftriaxone initiation, there was fever, tachycardia, and other Herxheimer-related symptoms. Now, the symptoms gradually resolved with treatment progression, but the Lyme test never became positive, which is pretty common in someone who's had Lyme disease because it takes several weeks to get a positive. Also, the neonates may not have had time to generate an antibody response due to that being so young. Now, this author reported a Herxheimer reaction is a transient clinical phenomena which has been seen in syphilis, leptospirosis, relapsing fever, and Lyme disease, which is a sudden onset of symptoms after starting treatment. It's not clear where this Herxheimer comes from. They initially thought it was endotoxins, but more recently there appears to be a rapid killing of spirochetes with release of bacterial components. There's a release of cytokines with tumor necrosis factor alpha and interleukins, which leads to a cascade and subsequent symptoms. This author and colleagues emphasize that clinicians need to be prepared for Herxheimer reaction no matter what age after starting antibiotics in a newborn. There was also a risk of disseminated Lyme disease even in newborn nurseries because it's something you normally think of as adolescents and adults. Shows you how quickly you can have a rash phase in some select patients. Now, it allows us to discuss some of the broader range of Herxheimer reactions that you see, most likely in adolescents and adults. You're not going to have all these symptoms in a newborn, but it's fever, severe polyarthralgias and myalgias, chills, hypotension, tachycardia, non-paretic, non-palpable rash, nausea, headaches, and worsening of existing symptoms. The summary of this study was that early recognition and treatment was important in newborns. Anticipation of Herxheimer reaction is possible in this particular study. Now, I can tell you that Herxheimer reaction has been coined as a Herx or Herxing by patients who have flare-ups even when they're not starting an antibiotic. So you'll hear that term quite often. There isn't much research in that area. And also, is there a better term for flare-up? Now, these are the two authors. The second author was that discussing Herxheimer reaction. Now, what I wanted to do is just kind of review this particular case just to get a better understanding. So, you ready for a quiz? What is a Herxheimer reaction? That's a transient reaction to rapid killing of spirochetes, leading to an inflammatory response. What were the primary symptoms observed in this newborn case study? In this case, it was decreased activity, poor feeding, and abdominal distension. And how was the newborn likely infected with Lyme disease? This was a recent tick with an erythema migrans rash. There are rare cases where congenital transmission has been described and documented, but it's difficult to document such cases. But there are pregnant women who get bit, and there's a study of where a infected patient developed Lyme, and then after the babies were born, the babies presented with babesia. Which antibiotic was used to treat the newborn Lyme disease case? In this case, ceftriaxone, but I typically do a follow-up to make sure there's not another tick-borne illness. How soon after starting treatment did the newborn develop a Herxheimer reaction? In this case, it was within 2 hours, but I think that's quite variable in practice. Which of the following mediators play a key role in the inflammatory response of a Herxheimer reaction? The authors discuss tumor necrosis factor alpha and interleukins. And why can Lyme disease tests be negative in neonates? Well, neonates don't produce antibodies early in disease, but A might be of interest because the tests are not as reliable in any age as I would like. Which of the following is an appropriate supportive care measure for managing a newborn with Herxheimer reaction? I certainly wouldn't be dealing with steroids in an infection unless one needs it for a different reason. In this case, they monitor vital signs and provide fluids as needed. And lastly, besides Lyme disease, which of the following infections is also associated with the Herxheimer reaction? In this case, it's syphilis. So thank you for joining us for a common sense Lyme disease case discussion. And I thought this case was rather interesting because it highlights a lot about Lyme, about tests, and about a particular concern about Herxheimer. It also allows us to hear and discuss the Herxing or Herx term. I'll be going live, and I'll be able to discuss this with the viewers and answer your questions. So thank you again for spending time with me as we discuss this case as part of a Common Sense Lyme disease series.